Now, I wanted to do a video series where I discuss how psychiatric medications affect the brain for the worse, okay? And I thought it would be suitable to do this because I've talked about how psychiatric medications are neurotoxins. Well, they're not the only drugs that are neurotoxins, but what makes psychiatric medications special is that they, most of them don't really have any real uses outside of as a psychiatric medication. Okay? Some of them do, some of them have off-label uses and things like that. But the thing is, they're not really usable for any legitimate medical concern. Okay? Some of them are, like I said, some of them are anti-seizure medications and things like that. And for example, right now I'm on a serotonin reuptake inhibitor because of the autonomic dysfunction I have as a result of the Seroquel I was put on. But it's very low dose. I'm only on like 30 milligrams or something, which is a dose for neuropathy. But that's the thing. Some of the drugs do have a usage at different dosages for things like epilepsy and things of that nature, okay? But most of them are keyed into working primarily on psychiatric disorders, not medical diseases. And that's an issue because there are actual medical side effects to these drugs. So what's the theory behind how these drugs work? Well, the one is they block the action of dopamine. So if you know anything, dopamine is your reward neurotransmitter. So when you block the action of dopamine, you become very melancholy-ish, like very humdrum, if you will. And that's an issue because it's causing a psychiatric issue there. So they're saying some scientists believe, so they don't know for a fact that some psychotic experiences are caused by your brain producing too much of a chemical called dopamine. They don't know that. They're not testing your dopamine levels. So this is not, you don't go to the psychiatrist and get a test that says your dopamine level is high. We need to lower your dopamine level. You understand? So this is a theory that does not necessarily pan out in reality. Dopamine is a neurotransmitter, which means that it passes messages around your brain. Most antipsychotic drugs are known to block some of the dopamine receptors in the brain. This reduces the flow of these messages, which can help to reduce your psychotic symptoms. Again, they believe. This is not actually proven. Okay, so they're saying it reduces your psychotic symptoms. Now, I've known people that I've worked with in the field, and I've also known people like friends and stuff that have been psychotic. Psychotic. Do you understand? They have been psychotic, and they have been heavily medicated. And the medication does not stop the psychosis. It doesn't stop the psychosis. What it does do is it causes weight gain. It causes other health issues. It can cause heart disease, diabetes, etc., affecting other brain chemicals. Most antipsychotics are known to affect other brain chemicals. This may include the neurotransmitters serotonin, noradrenaline, and glutamate. These chemicals are thought to be involved in regulating your mood. Parkinsonism. Listen to this. This is the thing. The whole idea of psychiatry is to take a healthy brain and twist it out of shape. Parkinsonism. Some scientists believe that certain antipsychotics work by causing Parkinsonism, a movement disorder. This means that they may cause some of the physical symptoms of Parkinsonism, but they may also cause the psychological symptoms of Parkinsonism, such as not feeling emotions and losing interest in activities. These effects are more common with first generation or typical antipsychotics. So they're believing that they work. See? What's the science behind antipsychotics? They believe that they work by causing a movement disorder, which then causes the emotional issues. They're saying it literally is causing the emotional issues of loss of interest in activities and not feeling emotions or apathy. Does that sound like something you want to be taking? Antipsychotics may help relieve psychotic symptoms by causing changes to brain chemistry. This is just the different types of antipsychotics. So, let's see, side effects. So, what are the side effects of antipsychotics? Anti-muscarinic effects, bedwetting, blood disorders, body temperature problems, emotional effects, eye problems, heart problems, liver disorders, metabolic syndrome, neuroleptic malignant syndrome, neuromuscular side effects, sedation, seizures, sexual and hormonal problems, skin problems, suicidal feelings and behavior, tardive dyskinesia, tardive psychosis, and weight gain. These are the side effects of the medication that you're put on if you're experiencing mental health issues. What is antipsychotic-induced dopamine supersensitivity psychosis? So keep this in mind. They believe that a natural overproduction in dopamine, which they have not proven, is what's causing psychosis. However, when you push the body in one direction, the body has to overcompensate. So it has to compensate to stay normal. So if you're taking a person with a healthy neurochemistry, a neuroendocrine chemistry, and you're putting them on a drug that distorts that natural chemistry, the body is going to have to regulate that. And that's why you get something when you get off the drugs called antipsychotic-induced dopamine supersensitivity psychosis. This is a comprehensive review, and you can read most of this on your own. I'm not going to go through the whole thing. The primary findings of the present review exposed several observations. One is that the idea of iatrogenic DSP is as a mechanism that may drive the onset of relapse and induce the occurrence of once previously ameliorated psychotic symptoms. Now, what you have to understand about this, one of the things that people don't know about psychosis is prior to the use of psychiatric drugs, psychosis was transient. It came and it went, and some people had it once and never had it again, and some people had recurrent signs, recurrent psychoses or psychotic episodes. And there's a lot of medical issues that cause psychosis, toxicities, deficiencies, medical conditions, brain diseases. These are real medical conditions that if you're going to a psychiatrist, they are not being treated. Okay, although the direct mechanism of action is currently unknown, chronic antipsychotic usage does seem to be correlated with changes in the dopaminergic signaling pathway targeting key regulatory proteins, blah, 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 biological mechanism, yada, yada, yada. To build upon recent findings, future studies need to re-examine the characteristics of the dopamine, whatever, the system there. So the point is, The story of long-term antipsychotic treatment and dopamine supersensitivity psychosis needs further support, although preclinical experimentation has shown the presence of supersensitivity of postsynaptic striatal D2 receptors can be induced by long-term drug treatment. The evidence has not been wholly convincing when explored in a clinical setting. Now, the reason why you need extra research is to actually prove this. If psychiatrists held themselves to the same standard of scrutiny that scientists do, if psychiatrists did, you wouldn't have them prescribing these drugs, because the conclusions, there's not enough evidence to say that these drugs are beneficial in the presence of the potential harms they cause, or at least not enough objective evidence. There's plenty of wishy-washy feelings on the part of the psychiatrist saying that they feel like this does this, and they've seen this, and they know that, but there's very little actual proof when you really get down to it moving forward. Antipsychotic drugs could shrink patients' brains. So, let's keep that in mind here. So, this is from Nature. Evidence that prescription drugs shrink patients' brains would one might think suggest only one course of action. Okay. Unfortunately, it looks like Nature now makes me pay for things. Long-term antipsychotic treatment and brain volumes. Okay. Viewed together with data from animal studies, their study suggests that antipsychotics have a subtle but measurable influence on brain tissue loss over time, suggesting the importance of careful risk-to-benefit review of dosage and duration of treatment, as well as off-label use. Okay? Antipsychotic medications are linked to potentially adverse changes in the brain. The study, conducted across several North American centers and just published in JAMA, Psychiatry, could have an immediate impact on clinical, it won't, but it should have an immediate impact on clinical practice, according to lead supervisor, yada, yada, yada. Antipsychotic medications were primarily administered to people with schizophrenia, but since then their use has expanded to major depression. Think about that. You're giving somebody something that reduces their ability to experience dopamine, to have dopamine, which is their reward neurotransmitter, to somebody with major depressive disorder and a range of pediatric, adult, and geriatric disorders, including anxiety, insomnia, and autism. So think about that. They're given to people with major depression, pediatric, adult, and geriatric disorders, including anxiety, insomnia, and autism. Antipsychotic medications remain the cornerstone of treatment for primary psychotic illnesses, but caution should be exercised with their off-label use for other conditions when psychosis is not present. This may be especially true in children and the elderly when the brain is changing more rapidly. Okay. The study examined both younger adults, yada, 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 yada. Okay. The Center for Addiction and Mental Health in Canada's largest mental health and addiction teaching hospital, research is fully affiliated. Okay, wait, let's see here. When psychosis is present, the life-threatening, the study found evidence that sustained use of whatever versus a placebo was associated with potentially adverse changes in brain structure, namely the thinning of the cortex. These changes were more prominent in elderly study participants, but participants who experienced a relapse of psychotic symptoms also had potentially adverse changes in brain structure, emphasizing the essential role that antipsychotics play in treating disorders where psychosis is present. So I'm going to be doing a series of videos on intelligence, okay? And people keep saying, why do we keep getting stupider? Why do we keep getting stupider? Why do we keep getting stupider? Well, brain volume shrinkage parallels rise in antipsychotic drug dosage. And this is proven with magnetic resonance imaging of brains of patients with schizophrenia that suggest while treatment with an antipsychotic drug may alleviate symptoms, it may also contribute to reductions in brain volume. Okay? It is possible that although antipsychotics relieve psychosis, that's possible, but I've never seen it. These drugs may not arrest the pathophysiological processes underlying schizophrenia and may even aggravate progressive brain tissue volume reductions. The reduction in brain volume in schizophrenia occurs not because brain cells die off, but rather because dendrites shrink in dendritic. See, this is the thing that people don't understand. This is why people need to look into Dr. Abram Hoffer's usage of nutritional therapies. But vitamin C especially. That's why in vitamin C and B vitamins. That's why in people with schizophrenia, thinking becomes more stereotyped, routinized, and concrete. They don't have the elaborate richness of synaptic connections to allow for cognitive and intellectual processes to occur. Okay? Now, what's funny is anybody that's been on psychiatric medicine can attest to the fact that it takes away your ability to have elaborate richness. And okay, to see what effect antipsychotic drug treatment, yada 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 yada. Since the findings do not change when we analyze the data using different measures of illness severity, it suggests that the results are fairly robust. The potential co-founding blah 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 blah. The longer patients were followed up, the greater their changes in brain volume. As time passed, they lost total cerebral tissue, gray matter, and subcortical tissue, but saw enlargement of parietal white matter, lateral ventricles, and sulcal cerebrospinal fluid. So what you're having here is because there's an imbalance in neurotransmitters caused by the drug. You don't have to be a doctor to figure this one out. I'm not a doctor, so this is not medical advice. This imbalance in neurotransmitters is causing atrophy of certain parts of the brain and hypertrophy of other parts of the brain. Moving forward. Researchers warn of brain atrophy in children prescribed antipsychotics. Okay, the authors write that it is accepted wisdom in psychiatry that children are more susceptible to adverse effects of second-generation antipsychotics such as obesity, diabetes, and sedation. However, the brain changes brought on by antipsychotics are a more controversial subject. Some psychiatrists have suggested that psychosis itself is responsible for brain atrophy and that medications may protect the brain by reducing symptoms. Unfortunately, according to blah, 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 in which longer duration of antipsychotic use and higher dosage of antipsychotic medication were both associated with brain volume loss, meaning the higher the dose, the smaller the brain. The researchers controlled for co-founding factors such as duration of psychotic illness, severity of symptoms, blah, blah, blah. This suggests that illness severity cannot be used to explain the loss of brain volume. So the severity of the mental illness does not explain the loss of the brain volume. Likewise, studies in both monkeys and rats show that when healthy animals are exposed to antipsychotics, they lose an average of 8 to 11% of their brain volume, especially in the frontal cerebral cortex, the part of your brain that makes you a person, the part of your brain that is responsible for thinking. Okay, the researchers tested both Haldol and olanzapine, whatever, meaning that the effect was found for both first-generation antipsychotics and newer second-generation antipsychotics. These findings are especially troubling in the light of recent evidence that children are prescribed antipsychotics in the absence of any psychotic symptoms. Moving forward. Antipsychotics damage the brain. Unlike uncontrolled studies, randomized, double-blind, placebo, blah, 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 blah. Okay, this is about the same thing. It results when comparing, taking meaning the drug was responsible. The drug was responsible for brain damage. Keep that in mind. Brain atrophy and antipsychotic medication, and a systematic review. So it is well known that schizophrenia has neuroprogressive component with many patients, blah, 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 to explore, blah, 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 blah. Brain volume reduction in patients, blah, 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 blah. The findings indicate there is evidence for gray matter, blah, 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 blah. Severity of disease alone, but is very likely a manifestation of long-term effects of antipsychotics. So the brain shrinkage is a result of the long-term effects of the antipsychotics. When we come back, I'll be talking about the neuroprotective effects of quercetin in Alzheimer's disease, which is another brain shrinking disorder. How multivitamins improve memory in older adults. The cognitive benefits of vitamin C. And a proven protocol to reverse brain damage. And that's all for this video.